Hi, I'm Angelica. I'm a level 1 nursing student. Do you have time to give me SBAR?
Yeah, I do. We're taking care of Shanana O'Connor. She's a 34-year-old African-American female.
Any burning or anything?
She has an allergy to trimethoprim solmethoxazole, and it's a mouthful. She's a full code. Her doctor's Dr. Engelbert. She's on universal precautions. She has a fever of unknown origin. She has end-stage renal disease, and she's undergoing hemodialysis. She's been a type 1 diabetic since she was 8 years old. She has a left forearm AV graft. She had that a little less than 11 months ago. Her pain level is 4. We did give her some Tylenol, so we're going to ask her how her pain level is. She has proliferative retinopathy and diabetic neuropathy. She has numbness and tingling bilaterally. She denies any muscle or joint pain. She has a good range of motion. She denies any shortness of breath, pain with breathing, or recent colds. She quit smoking 2 years ago, and she denies any swollen or tender lymph nodes. She doesn't have any chest pain or palpitations. She does take aspirin, 81 milligrams PO daily. She denies any abdominal pain. She did have a recent weight gain of 10 pounds over the last few weeks. She's on a renal disease diet. She had a recent decrease in her urine frequency and volume. She denies any pain or burning or difficulty. The concentration has increased and it's darker in color. Her intake is 35 ml and her outtake is 200 ml. She did have an infection 3 months ago in the AV graft, but it was resolved after an IV antibiotic. Her skin's intact. She has no issues with that. She has an IV in her right medial peripheral vein, and she's getting 0.9% saline continuous. She has labs pending, and she does show positive for white blood casts in her urinalysis, and she has a temperature of 101.1. Her heart rate is 95, her O2 stat is 96, and she has a BP of 138/78, and we did an AccuCheck at 7:30, and her blood sugar was 155.
Okay. Thank you. Why specifically is the client receiving this medication?
She has a fever of unknown origin, and like I said, her urinalysis shows white blood casts, positive for those, and that's indicative of infection. And since her urine culture is pending, we just want to give her a broad spectrum antibiotic. We're going to give her Impamycin and Cilastatin just to cover any infection she may have in the body.
Okay. And what action does the medication have on the body?
This type of antibiotic inhibits cell wall synthesis, so it treats infections caused by bacteria by killing or preventing their growth.
Okay. When should you question administering this medication?
I'd question it if she had any allergies, which we did. She should have an allergy bracelet, and we'll look in the MAR to make sure. But she, is listed as having an allergy. And if they're allergic to any other antibiotic, especially penicillins or cephalosporins.
And does the medication have a therapeutic serum level?
Not per se, but to ensure the therapeutic effect of this drug, we recommend a dosage for optimal effects, and that's 250 to 500 milligrams for mild to moderate infection every 6 hours, 500 milligrams to 1 gram for severe infection, and with the max being 4 grams per day.
Which vital signs should be monitored?
All should be monitored, particularly since she had a fever, her temperature.
Which physiological parameters should be monitored when the medication is being administered?
Well, of course, her lab values. We want to monitor the IV site and check it for patency, make sure there's no swelling or redness or infiltration. And we want to check her skin for hives or itchiness or edema.
And what interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
Well, we always want to check that it's the right patient, the right medication, the right dose, the right route, the right time. Of course, the patient always has the right to refuse. We always want to monitor the IV site and I would explain to the client why they're taking this medication and let the patient know what reactions to look out for.
What interventions must be taught for taking the medication safely at home?
Well, I'd have the patient report any fever or diarrhea or blood in the stools, because this can happen up to a couple of weeks after taking the medication.
And what are the side effects and potential adverse reactions?
Dizziness, seizure, hypertension, diarrhea, nausea, vomiting, sweating, urticaria, allergic reactions, and C. diff associated diarrhea.
Okay, and how will you know the medication is effective?
Well, you're going to see a resolution of her signs and symptoms, and hopefully her fever is going to go down, her temperature is going to resolve.
That's all my questions for now.
Okay. All right. Would you like to go with me in the patient's room while I administer this medication?
Sure.
Okay. Hello, Miss O'Connor.
Hello.
I'm April. I'll be the nurse taking care of you today.
Okay.
And this is Angelica. She's a level 1 nursing student. Just let me wash my hands before we get started. And can you tell me your name and date of birth?
Shananna O'Connor, and I'm 34 years old.
Okay. Let's check your bracelet. And I noticed you have an allergy bracelet, and I'll check that in the MAR. And it says that you're allergic to trimethoprim sulfamethoxyl.
Yes.
That's a mouthful, Bactrim. What happens when you take this medication?
I get a rash.
Okay. And you definitely want to look out for that.
Yep.
Okay. The doctor has ordered Impamytin Cilistatin, which is also called Primaxin. You may be familiar with it. Have you ever had this before?
No.
No? Okay. All right. I'll give you some information. This medication, there's some information for you.
Oh, thank you.
It can cause nausea, vomiting, diarrhea, dizziness, skin reactions. So please read over the information and familiarize yourself with it. Do you have any questions?
No. not right
Okay.
now.
I see you have an IV, so I need to check to make sure the IV is patent. And we're going to hang some regular IV fluid as well, some 0.9 saline. The doctor's ordered this because we want to keep you hydrated, and we want to start you on a broad spectrum antibiotic to treat you for the possible infection that you may have.
Okay.
Okay? All right, so we're going to check the site for redness and swelling, make sure there's no infiltration. Okay? Everything looks good. How does it feel?
It feels all right.
Okay. So anyway, I am going to flush it just to make sure that the line is good. Oops. But first, I'm going to clean the port for 15 seconds. Okay. Gonna flush. All right. Everything looks good. Okay. Do you have any pain?
No, I'm fine.
Okay. I know we gave you some Tylenol earlier. All right. We're going to give you your normal saline first.
You get so far, you're doing so well, and then alright, let's take your time. Do you want to read my thing? I actually wrote it down for just like step by step.
Okay. And again, your name and date of birth.
Shananna O'Connor, I'm 34.
Okay. Gonna go ahead and hang this on here for later. All right, so it's verified, it's turned green, and we want to check this bag for clarity, make sure there's no puncture holes for the expiration date. Okay, make sure it's intact. I'm going to check the mark. Okay, we're going to be administering this at 30 milliliters an hour in your right forearm. And of course, you know you always have the right to refuse any medication. And we're going to check that it's the right medication, which we did, the right dose, which we did, the right patient, we scanned your bracelet, the right route, IV, and the right time. Okay? So what we're going to do here is we're going to spike the bag. And I think I mentioned we checked the expiration date, but just in case I didn't, let's mention that again. These two things are sterile, so we don't want them to touch anything or get dirty. Okay. We're going to open up the clamps and prime the line. Lots of tubing. Okay, make sure there's no other clamps closed, which there is not. All right. Okay, and we're going to close the tubing for now. Hang that up there to keep it clean. Okay.
Hi, my name's Chris. I'm Richard Escobar. I'm a nursing student.
Turn the system on.
Her name's Marta Yarn. She's an 80-year-old female.
Gonna prime.
Allergies and a full code.
Okay, is this a new patient? Yes.
For a non-healing sacral ulcer.
Okay, medical search floor, yes.
Treated as an outpatient with no success. She was admitted from the
All
doctor's
right.
office. She's
Gonna
ordered
enter
for
your ID.
general identityness. Her pupils are equal or autoreactive to light and accommodation. Her gait is corded in but slow and she uses a walker. Her chest expansion is symmetric. Her lungs are clear in all fields. Her anterior and posterior are diminished.
Okay, we're gonna do a basic infusion.
Sinus rhythm with
The
premature
rate
She's vitals every 4
is
hours.
30. And we're
Her
gonna,
abdomen is soft, undistended,
it's a
tender, slightly obese,
1,000
masses.
milliliter bag, but we're gonna put it at 950 just so the pump doesn't run dry.
Lesions or inflammation in perineal area.
All right.
She's scheduled for debriefing in the morning. Her blood pressure is 144/90. Heart rate at 88. Respiratory rate at 24. Temperature is 99.1. Her pulse ox is 92%.
Clean for 15 seconds.
She's 4 centimeters by 4 centimeters by 1 centimeter. It has involvement of surrounding tissue.
We're gonna open the clamps.
Serious exudate without unusual odor. No
That's what
underlying
it's telling us to do.
She has
Okay.
porcelain turgor. She has IV and right dorsal metatarsal. Her labs came back positive for E. coli. And we're going to give her gentamicin and potassium, 20 milliequivalents in sodium chloride.
Okay, and we're just gonna restart. There we go. There we go. Got a green light. Okay. Wonderful. All right.
The client is receiving medication for her elevated white blood
Okay,
cell count.
so now we're going to give you your antibiotic. And what I'm going to do is go ahead and put this down a little lower so the pump will know what to do with it.
Does the medication have therapeutic
All right.
level? What vital signs should be
And
monitored? And when the
oops, it's
medication,
saying that we're occluded.
which physiological parameters should be monitored?
You should question nurturing to clients with renal impairment, renal failure, or renal
There we go.
hypersensitivity, hearing
Touchy little
impairment,
pump. Okay.
neuromuscular disease,
So,
pregnancy, and neonates.
what we're going to do
Therapeutic serum level
is
0.5 to 2 micrograms per
document that we
milliliter.
gave you the
The peak is 5 to
saline.
10 micrograms a milliliter. You should monitor vitals, hearing, serum aminoglycosides, concentration, serum creatinine, and BUN.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting, as well as home?
You should advise client of the side effects and what to report to the doctor.
And what are the side effects and potential adverse reactions?
The side effects are ototoxicity, neurotoxicity, rash, itching, decreased appetite, weight loss, respiratory, range depression.
How will you know the medication is effective?
When the client no longer has signs and symptoms of infection and lab values are normal.
Thank you.
So we're going to give her the
Okay. We'll document 30 mLs per hour.
I'll pull the medications out of the Pyxis.
Normal.
I'm going to check the expiration date on the
Okay.
bags. Check the color
And
of
the
the
patient
bags.
tolerated it well.
Make sure they're the right medications. I'm gonna check the pharmacy to make sure that these drugs are compatible.
And that we checked.
And then I'm gonna check the MAR to make sure that it's the right patient.
Let me check the IV
And
site.
check patient's
Okay.
allergies. Make sure it's the right medication.
All right. Now what we're going to do is administer your implementum psilostatin, your Primaxin. Okay, are you doing okay?
Mm-hmm.
Knock knock.
7:43. Noting the time. Okay.
Wash my hands.
And I want to check this against the MAR. It's
I'm gonna give you your medication today. It's a gentamicin, which is an antibiotic. Dick, dick.
500 mgs and 100 ml.
No. Can
Okay.
you tell me your name and date of birth? Martiana.
Okay, I want to check that it's the right
Are you allergic to anything?
patient, which I will scan your bracelet here in a second. I want to make sure it's the right dose, the right time,
Do you know
the
any
right route,
signs and symptoms you should report? Do you know if you're having a reaction to the medication?
and the right drug. Okay.
No. So you should watch out
And this
for
came
a
pre-mixed
rash,
from the pharmacy and
itching,
pre-labeled, so we checked with them.
vomiting,
And,
bleeding.
You know, again, you have the right to refuse, so if you have any questions or concerns, please let me know.
Okay.
Okay, so what we're going to do is get this medication up on the screen. I'm going to scan your bracelet again.
So, I'm gonna pull the medication, make sure again that it's the right patient, your allergies,
Okay, your name and date of birth.
Shananna O'Connor, 34 years old.
Okay. And just want to check your allergy bracelet again.
gentamicin.
Okay. All right.
I'm gonna check the patient's IV.
Turn green. Okay. I'm going to keep these ends as clean and sterile as possible. The IV tubing. Okay. The administration time is
Any burning
19:43.
or anything of this? No. Are you having any pain right now?
Hours. Okay. All right. So what we're going to do, we're going to try to maintain the sterility with the two. Spike the bag. We're going to hang this up. Okay.
I'm gonna prime the
clean.
tubing.
Clean for 15 seconds. We're going to hook the secondary medication into the primary pump. Okay. Oops. First I want to prime the line. So let's back up a smidge. Okay. And we want to do it very quickly and make sure that no medication is wasted. Okay. So we're going to clean again. I do see some air bubbles in there. Okay. So let's clean again. Make sure everything is clean. 15 seconds. All right.
Nail for your patient.
All right. So we're going to hit channel select.
Nail select.
Okay.
Cargo IV fluids.
Secondary.
We're giving a 0.9% normal saline.
And we're given
20
implementin.
milligrams of potassium.
Oh, gonna always want to prime that first. Okay.
The volume.
Okay. Implementin cilistatin. And there's the one we're given, 500 milligrams over 100 ml. That was selected. Yes. Okay.
Can you scan the patient first?
Okay. So far, so good. How are you feeling?
I'm feeling okay.
Okay. Your IV site looks good? Okay. And we did check the bag for color, clarity, the expiration date, and to make sure it was the right medication, the right amount, the right time, right dose. I think I said all that. But I don't know if I mentioned that I checked the expiration, and the bag was in good shape, no holes, so we're good. Okay. And we always want to check and make sure that we see 5 drops. Okay. And we want to label the tubing with the date and time, so we know when to change it in our initials. Okay, and with the medication that's in the bag. So this is for the implementin, and this is for the normal saline. Okay. Now, okay, I just want to advise you, I did give you some information. Oh, you know what? Actually, let me go ahead and document this while I'm in the room.
So I'm gonna give the gentamicin.
Okay, so we've given you your medications. We checked your pain level, and you said that was okay. Okay. I'm going to document your IV site. In the right forearm, right median vein, the gauge of the needle, insertion site clean and dry, intermittent flush per hospital protocol,
So I'm gonna
patent,
prime the tubing
dressings clean and dry,
with
and
antibiotic.
you tolerated it well, and the medications, okay? All right, so we've seen our 5 drops, we've hung our medications, the pump is working, we checked for patency, okay, and I gave you some information, and I want to advise you to report any signs of a superinfection, like a black furry growth on your tongue, or vaginal itching or discharge, loose or foul-smelling stools or allergic reactions. Consult your healthcare professional if fever or diarrhea occur, especially if the stool contains blood, pus, or mucus. This may occur up to several weeks after the discontinuation of the medication. Do you have any questions?
No, I'm good.
Okay, well, let me know if you do. Okay, I'm just gonna wash my hands. Okay, and I'm going to give you your call light and put your bed down, and let me just give me a call if you need anything, and I'm going to document that we gave you teaching.
15 seconds. So I'm gonna click secondary. Then I'm gonna click gentamicin. Every 8 hours.
Medication reconciliation, that we
Use 80 milligrams.
explained it and discussed it, and that you did understand. Okay. All right. So, all right, I'm just going to go back out here with my student. Thank you for letting me bring her in,
Mm-hmm.
and I'll check on you in a little while.
Okay, thank you.
Okay. Do you have any questions for me?
Yes. Were there any pertinent pieces of information you reviewed before administering the client the medication?
Well, we did note the temperature. The patient has a fever of unknown origin, and we reviewed all the vital signs. The white cast was positive in the urine, and we reviewed her history and her allergies, and any available lab tests. So we did give her the broad spectrum because we just want to take care of any infection while the labs are pending.
Do you have any questions?
Okay. And did this information affect your decision to administer the medication?
Yes, the information was helpful. It helped us decide to administer it, and we'll continue to take the vitals and document them, especially the fever, and we will document any
Do you have any questions?
labs or any abnormal results as well.
Okay. And did this information affect how you administered the medication?
Yes, it helped determine the dose and the route and the method we use to administer it. Also, the drug information explained the medication needed to be administered slowly because of rapid infusion. Because rapid infusion may cause nausea and vomiting.
No, everything said that I should administer it.
Okay. That's all my questions. then.
Okay, all right. Well, thank you. Maybe we can work together again.
Yeah. Thank you.
Okay.